session of Accreditation Essentials, Key Elements, and Common Non-Compliance Areas. This session has been put together because we often get a lot of questions around many things to do with accreditation, and accreditation tends to be both a fun and mostly stressful time for a lot of clinics. So I thought let's put a quick session together to at least either introduce what accreditation is and the process to those of you who are new to accreditation, or as a refresher. If you've already been through accreditation many a times, it's always still good to touch base with what might be new, what you may or may not have covered in the past. The accreditation visit may have happened and you may not have been part of the practice, even though you may have been involved with the preparation. So hopefully this will give you a good overview of the whole process. So let's get started. I wanted to start with a quick quote that says, accreditation shows patients that your practice is serious about providing high quality, safe, and effective care. This is a quote from the RSCGP Standards for General Practice, the 4th edition, and I think it quite nicely encapsulates what we're trying to achieve with the process of accreditation. So a lot of practices think, look, you know, it's something that we have to go through. It's something that we need in order to get access to financial benefits such as PIP and things like that. But really, it's as we'll cover in a bit, it's really an opportunity to reflect on the practices and to improve on the systems and procedures that we've got going on. So, what are some of the benefits of accreditation? Why go through all the trouble? One of the key things is obviously ensuring that the policies and procedures that we have in place at our clinic are in line with best practice. So that means that it's meeting the standards, as we call them, of the general practice profession. Another benefit is obviously if we're following all the procedures according to best practice, we are also protecting the clinic from a medical legal point of view. We're protecting the staff, and we're also protecting the patients and our local community because of all the different components that we cover as part of accreditation, which we'll have a look at more closely in a minute. Now, we also know that the accreditation process provides the practice with an opportunity to reflect on the current systems that we have in place, and also it gives us a chance to explore what areas could be improved, or what areas could really do with a bit of a sprucing up. The other benefit is it serves as a prompt to review, update, or upgrade equipment. I often say one of the most magical things you could ever say to a practice principal or to a practice manager if you're needing new equipment is, "We need it for accreditation." It just seems to be one of those times where we can actually justify the purchase and the upgrade of a lot of the things that we have around the clinic. So that's a nice little trick to have up your sleeve if you're needing to purchase any kind of equipment, or you're sick with the fridge that you have. It can often work if you go back to your practice principal and say, we probably need it for accreditation, just to get things over the line. The other thing is it gives a practice being accredited, it gives professional recognition amongst peers. So a lot of GPs will be more attracted to working in a practice that is accredited because it's recognized that then it's practicing to a certain level of quality. And last but not least, and this is one of the big motivators for many clinics, is the financial incentive that a clinic can access when they are accredited. So, for example, we hear of the PIPs and SIPs, so the PIPs being the Practice Incentive Program, and things like the PNIP, the Practice Nurse Incentive Program, which is the bulk core funding that practices are eligible to apply for if they're engaging the services of a nurse. You can only really access those financial incentives if the clinic is accredited. So that's another benefit. All right. So now let's talk a little bit about the process of of accreditation. Usually you'll have the initial step will have either a self-assessment. That self-assessment is a bit of a checklist that often happens online. This is the process that happens with ACPAL. The process that happens with GPA, and ACPAL and GPA are the two bodies that provide accreditation services. So they're the organizations that provide the surveyors to come out and visit the practice. So with ACPAL, there'll be an online self-assessment or checklist. With GPA, they'll actually request that you submit preliminary documents. So there'll be a list of documents, which in theory means that when they come into the clinic to do the practice visit, the process is quicker because they've already witnessed a lot of the key documentation. The next step is that a practice visit is set up, and it's usually going to be 2 surveyors, at least 2 surveyors. If your practice is quite large, you have a lot of GPs, you may actually get more than 2 surveyors. The key thing is you need to have at least 1 GP. There's usually 1 GP and either a practice manager or a practice nurse. Now, the next thing that happens is all staff are interviewed on how things are done at the practice. So they will actually interview the practice nurses by themselves. They'll interview the practice managers by themselves. They'll interview the GPs by themselves. And obviously, the aim of it is to get a bit of an idea of how each staff perceives the procedures or the systems, the way things work in the clinic. Finally, a report is written by the surveyors. So the surveyors are not saying yes, no, you're accredited or not accredited. All they're doing is they're asking questions and looking at the evidence around the different indicators, which we'll talk about in a little bit. Then they will put together a report, and that report goes back to ACPAL or GPA, and then there is actually a committee that decides, based on the information on that report, whether or not the practice meets the requirements to be granted accreditation. If there are areas of what we call non-compliance, or if there are indicators that are not met, then what GPA or ACPAL will do is provide a report back to the clinic and request additional information or evidence for those areas to make sure that obviously the aim of accreditation obviously being quality improvement. So it's not about passing or failing you, it's about identifying the areas that are not quite there or that could use some improvement. Okay, so the standards that we use are, the current standards are the RSDGP Standards for General Practice, 4th edition. Here's a nice little image of what they look like. You can either access these standards for free online, and I will show you how to do that just now, or you can actually purchase a hard copy and have it in your clinic. So in order to access them online, I'll just show you, if you go into any search engine, Google for example, we'll do RSDGP. And if you start writing standards, there we go. It's the first result that comes up. And here we go. So it actually brings us up to the Standards for General Practice page. And you can actually browse here. Actually, see there. You can actually browse here the different sections and click into all the different standards and criterions. So as you'll see here, it's got the standards are divided into different sections, and within the sections they have specific standards. So for example, within the practice services section, we've got access to care, information about the practice, health promotion and prevention, and within each one of those standards there's these things called criterion. So for example, criterion 1.1.2 is telephone and electronic communications. If I click on that one, it'll actually take me to the description of this criterion, and it'll have the indicators. Here, these are our key criteria. So what you see here, indicators, you'll notice that some of these they're listed they're listed in letters. So I was going to say enumerated, but they're not numbers, it's letters. And they've either got a little triangle next to them or they'll be by themselves. So in this instance, A and B, indicators A and B have a triangle next to them, which means they are required indicators. Your practice needs to be able to meet these indicators in order to become accredited. these used to be flags and not triangles in previous editions, so that's why we used to call them flagged indicators. Now it's just a triangle, so I guess you could call them a triangled indicator. But then for this third item here doesn't have a triangle, meaning it's not a required indicator. So in this instance, we've got things that are required. A, our practice team can demonstrate how we receive and return telephone and electronic messages from patients. This is something that they will discuss, or they will interview staff about. How does this happen in your practice? B, indicator B, is for important communications. There's evidence of practice and patient telephone or electronic advice and information in our patient health records. Now, C is not required, but they're there because it's recommended, but you won't be, accreditation won't be withheld if you don't have this in place. And in this instance, our practice's on-hold message, if we have one, provides advice to call 000 in case of an emergency. So there we go. That's an example of how indicators work. So that means that we don't have to have that. Obviously, it's advisable that we do, but it's not required. After that, you've actually got the explanations. If you want a bit more information as to, well, what do they mean by evidence of telephone contact, then you've got key points and a good description there. So that's how you would navigate your way through the different standards and criterions, and that is essentially what the checklist or the self-assessment is for those of you that are using ACPAL, is going through each and every one of these criterion and indicators and acknowledging, yes, we've got that, we've met that, we're ready for a visit to take place. All right, so let's go back to our presentation here. I've put together a checklist which I will make available to you after this presentation. So you can either, if you're watching this live, I will email this document to you, or you can request it at any time. If you're watching the replay, the document will be available to download just below the video. So I've put together a quick document, and you don't have to try and strain and read this. I'll go through this in detail. And it's the top priorities for an accreditation survey visit. These are the areas that will be covered every single time a surveyor comes to your practice. So regardless, when the practice visit happens, they won't cover all of the indicators. They'll pick and choose seemingly at random, but these areas will be covered every single time. So let's have a closer look at what they are. One of the main things they're going to do is they'll conduct a review of the doctor's bags, the bag or bags, depending on how many you've got in the clinic. And with the doctor's bag, I've put this in orange because this is one of the common areas of non-compliance. Not that the practices don't have them, but often they'll have them in either it will be missing components, or if it's got medications or drugs for emergency care, they'll be out of date. So that's one of the biggest things, is stock that is out of date. Often you'll find them in doctor's bags. This is, if you've got practice nurses in your clinic, the practice nurses will often be given the responsibility to check and update the doctor's bag. The other area is Schedule 8 records and storage. If your practice is storing Schedule 8 drugs, these are things like endone or morphine, they need to be properly stored. Obviously, these are drugs of dependence, and they're restricted substances, so they actually need to be under lock and in a safe. Also, the documentation of doses that are given is quite thorough, and obviously we need to document how many doses are received whenever we've ordered the stock, and also if we're getting rid of expired stock. All of that needs to be documented and either have a couple of signatures or definitely a GP signature as part of it, and document how those doses were disposed of. Medical records, what's often called health summaries, patient health summaries. It's another big area where practices tend to fall, and that's mainly because either the summaries won't be complete. For example, they'll either be missing smoking or alcohol history, family history. The list of of conditions is usually fine. The list of medications is an interesting one, because what will often happen is they'll usually be medications that are old prescriptions. For example, antibiotics that the patient had 2 or 3 years ago, and so there will be a really long list of medications, but that's not actually reflecting the current list or the active medications that the patient is on. So that's one of the areas that practices get pulled up a fair bit. So comprehensive health summaries. And allergies, we hear a lot. We need to have at least 90% of allergies recorded. Obviously, not over 90% of people with allergies, but we have to say if they don't have allergies, then click the no allergies recorded option in our clinical software. Another area, and you'll see this one is usually met, that's why I haven't put it in orange, is the doctor's RACGP points, their QA and CPD points, and their APRA registration. So we need to have their current registration and their points up to date. Also, practice information sheet, and within the indicators, it's actually within the standards and within the criterion and indicators, it actually specifies absolutely everything that needs to be part of a practice information sheet. If you want a sample, you can always email me. I might actually put a sample template as well on below the video of this recording. The other area that is important to make sure that we're following in our practice is collecting emergency contact person for patients. This is different from the next of kin. So a lot of practices are used to collecting next of kin, but you should really be collecting an emergency contact person. So who does the patient want us to contact in case of an emergency? And that the most obvious place to collect that, obviously, it's at the time of registration when new patients sign up. But if you haven't been collecting it, then it's a good idea to start implementing it with previous patients or with your usual patients to make sure that you update those records. Okay, additional areas, you have to make sure that you have examples on the day of the following. After hours visits. So these are visits that have taken place once the clinic has closed. And this can either be visits that have been done by another service or provider, for example, a locum GP, or services that have been provided by the practice, if the practice provides their own after-hours care. So the evidence of this is going to be in patient notes. So these obviously you would have to pull up in advance to have ready for the surveyors to look at on the day. The other thing is evidence of home visits or visits to institutions within opening hours. So a lot of some practices get confused and say, "Oh, I've already got the locum." The locum goes out and does home visits. But there has to be actually evidence of visits that happen during business hours, not just by the locum service after hours. So that can either be home visits or visits to places like residential aged care facilities. The other area is evidence of patient-doctor phone contact. So obviously not whenever there's a telephone conversation and there's any kind of advice that takes place, and this is not just with the GP, but also with staff, especially nursing staff, you're providing health advice. It should be documented what took place so that we have an audit trail. Okay, additional areas. These are things to have ready for review on the day. The current registration of GPs and nurses, make sure they're up to date. Current CPD activity statements for all doctors and nurses within the practice. Certificates of continuing education or training for the past 3 years for all other staff. So with it's not just the clinical staff that needs to do continuing professional education, it's also the admin staff, and key areas are going to be things like infection control or triage or cold chain, how to check the vaccine fridge. I've actually put together a set of staff training sheets, which I will make available after this presentation, but you can actually, they're available to download from the practicenursing.Info website at any time. And the idea with those staff training sheets is they cover a series of the main topics that we need all staff to be inducted in. So that's when they're brand new staff and they're starting at the clinic, make sure that they're all learn those key areas, but also it provides a good template to refresh and update staff on a regular basis. So what we do at some of our clinics is we just have a roster where, not a roster, but a schedule where whenever we have a staff meeting, we will pick one of those topics. For example, this week we'll review infection control and go through our staff training sheet. At the bottom of the staff training sheet, it actually has a staff, an area for staff to sign, so that they acknowledge that they've received training and that they feel confident and competent in that area, and that they've obviously, they know where the policies for our clinic are, and they agree to adhere to them. So that actually, that signed form acts as a certificate of, or an evidence of in-house staff training, which is a great thing to have for accreditation. The other thing we need to have is a CPR certificate for GPs, nurses, and staff. There are either sometimes Medicare locals or the previous divisions of general practice would run CPR sessions at their offices, but obviously you can get your own. You can either send your staff to do CPR at any other provider, or there are many companies that will come to the practice, and over a couple of 2 hours usually, they will go through the theory and practical components, and they can do up to, they can do the whole staff, all the GPs and nurses at the same time, which is quite convenient. You also have to have an induction program for new GPs and new staff. There's actually a checklist and template for that as part of the staff training sheet. So that's almost good to go there. You also need to have obviously job descriptions and position statements for all staff, which is part of your policy and procedure manual, and this is something that is part of human resources, so your practice manager should be on top of this. And another thing is immunization status for staff. Now, staff don't have to be immunized, but we have to check status initially, and they can refuse immunization, but that has to be documented that at least immunizations have been offered to staff, and that the risks of working in a medical environment have been explained. Okay. Additional areas are having either a register or minutes of meetings. These should be staff meetings where all staff are present, or key staff, and also clinical meetings. So there shouldn't just be one general meeting for everybody. There should also be meetings where it's just for the clinical staff, so that would be the doctors and the nurses, to discuss either areas that are clinically tricky, or potentially risks, or near misses, or specific cases, perhaps if there's specific patient cases. You also need to have an evidence of contract for after-hours arrangements or rosters. So that's evidence from your either locum service, if you've got an arrangement with one of them, or evidence that you've got your own providers, your own GPs providing the after-hours care, or whatever other arrangement you have in place. There has to be documented evidence of that. The other thing is you need to have evidence or your contract for disposal of sharps. What company is getting rid of your sharps, your biohazardous waste, and your confidential waste. This is another area that we've marked in orange, and that's vaccine fridge cold chain audit. So the way that we monitor our vaccine fridge, and it could either be data logging. So there's the data logging or data loggers that allows to monitor a fridge over, say, a week or a longer period of time to check how the temperatures are fluctuating, which gives us obviously a better picture than just checking a thermometer, a maximum and minimum thermometer. But data logging is not required. It's recommended, but it's not required. What's required is an audit, doing an audit of your fridge, and there's actually an audit checklist as part of the Strasser 5 National Vaccine Storage Guidelines. Again, I'll put we actually have links for all of these key resources currently on the website under resources and accreditation, but I'll also list them at the bottom just below the video. The other thing is evidence of annual vaccine fridge maintenance as per manufacturer's instructions. And this is a big one, a schedule of maintenance of key equipment. So this is if you can imagine, a master schedule that says all the different types of equipment that we have in the practice. For example, we may have a sterilizer, we have blood pressure machines, and we've got scales and all the different equipment and vaccine fridge, and how frequently those need to be checked. So for example, we might have in there that the battery on the thermometers need to be checked and changed every 6 months or every year. We'll do we'll do the maintenance of the sterilizer. So that's a master schedule. You should also have a schedule for routine cleaning. So that's not just the cleaning that you might contract a cleaner to come in and do after hours. There should also be a roster or agreement between staff, and this could be the admin staff or including the nursing staff, to do cleaning of surfaces at least once in the middle of the day or once throughout the day to prevent, obviously, cross-infection. Okay. Additional areas that surveyors will always check: sterilizing. If your practice does any sterilizing either on-site or off-site, this is an area that surveyors will be looking at very closely. So obviously there's the calibration of the sterilizer or the autoclave machine. So this is a proper yearly maintenance that's done usually either by the manufacturer or another, usually companies that can come in and do a check. You'll need to have evidence of the pack and load process for sterilizers. So when they do the annual calibration, they will check the maximum load. And if you're doing it in-house, this is the thing, or even if you're sending sterilization or equipment to be sterilized off-site, they will ask you to walk them through the entire process of how do you do the cleaning, the packaging, the sending off, or the processing, and then finally the documentation. How do you make sure that it's reached the right temperature? What indicators are you using? Okay. Sterilizing logbook, the other thing that I want to look at. And again, this is something that the hardest pack to sterilize, and the sterilizing instruction manual. The hardest pack to sterilize is something that's identified and tested at the time of the yearly calibration or yearly maintenance. So they'll see what's the maximum number of instruments or packs that we can have in the sterilizer, and what's the hardest or trickiest pack to get through. And obviously having the indicators to make sure that it's reached the right temperature. Okay. More areas. Patient feedback approved by the RACGP. This area has changed since the last standards. In the past, we used to just be able to print out the list of questions, have the patients fill them out, and add it up ourselves, and that was it. Now it's actually changed, and it needs to be an approved approved questionnaire, approved feedback form, and the two recommended companies. So the majority of people now or practices are going through external third-party companies. The two recommended companies by RACGP are CFEP and Ultra Feedback. There's links to both of them on the accreditation page of practicenursing.Info. And how they work is you would contact them, you'd let them know how many GPs you've got working or what your full-time equivalent is, and then they would issue you with the correct number of surveys. And the surveys come ready. You can just hand them out to your patients, and then they'll either supply you with ready envelopes, so the patients will fill them out, put them in the envelopes, send them back, and these companies will actually do all of the adding up and the analyzing of the information and putting a report together. So they will charge a fee for that, but it does mean that it frees up some of the practice staff time. The other thing that we need to have is a computer security checklist, which is provided by the RACGP, and you would usually do this in conjunction with your IT staff or the IT support. One of the areas that's often missed is the disaster contingency or disaster recovery plan, or what's also called a business continuity plan. So this is a plan, and there's templates for this to walk you through it and help you, obviously, to tailor it to your practice's needs. This is the document that outlines what do we do in case of a disaster. So, for example, if there's a power outage, or if there's a flood, or if we come into the clinic on Monday morning and we discover that the clinic is actually burned down, how are we going to do business continuity? So a lot of those things will be around backups and the data being backed up. For example, we recently had a power outage in Melbourne, and some clinics were not quite sure where their disaster contingency plan was, or how or what was in it. But that was one of the perfect examples of, well, what's the plan? What do we do when we have a power outage? Are we going to continue to see patients? Or are we going to send patients home? How do we obviously we can't access our patient records. Are we going into paper notes? How are we managing the billing? How are we checking for pathology? So all of those things, and there's again, the template will provide you ideas already. All of those things need to be covered as part of that document. The other thing that you need to have is a list of improvements that the clinic has made in the last 3 years. Remembering the accreditation cycle is every 3 years, so they always want to know it's continuous improvement. So what has changed since the last time you were accredited? If it's the first time you're being accredited, obviously you don't need to provide this. You'll either be a brand new practice, or if you've just been a practice that has never been accredited before, undoubtedly you would have made some changes in order to go through the accreditation process. So the list should be relatively easy to compile. Now, this is another area that's quite important, is what improvement has been made, an example of an improvement that's been made to prevent a slip or mistake in clinical care from occurring. So, for example, this is what we often call a near miss register. Sorry, a slip or gone to the wrong. A near miss or slip register. It's different from an incident register. So it's not that something went wrong and something happened and we filled out an incident report. It's something almost went wrong, or something there was a mistake. An example would be a pathology slip or a repeat prescription, or actually more likely to be a pathology slip, was written up for the wrong patient. The GP logged in, or logged into the patient file, and there were 2 patients with the same name, and it was actually printed out for the wrong patient. Or there might have been an incident at reception where there was a patient who was being aggressive, and well, how was that handled? So even if nothing bad came out of that, it was an incident that's worth exploring, and these are the things that you would then address at a staff meeting to check, well, how would we handle this if it happened in the future? What kind of things can we put in place? So we need to have a near miss or or slips record. Additional areas, obviously, we need to have a policy and procedure manual. Having a manual the manual itself is not required, but there are key policies that are required. So these are the things that they'll want to have a look at and actually review the documentation. Home visits, you need to have a policy around home visits. A policy around review of results and letters received by the practice. A policy around cold chain, and there's templates for all of this, and I will provide the link to the sample templates below the video. A policy on infection control, policy on handover of patients. So this is a new area, and what this means is what is the policy, or what's the procedure in the clinic when, for example, one GP is going on leave for a couple of weeks. What happens to their patients? What happens to the results of those patients that are going to be coming in, and they might need review? So what's the process of handover to other providers, so for example, to other GPs, to ensure continuity of care for those patients. So we need a policy around that. Also a policy around practice feedback, one around adverse events. What do we do in case of adverse events? A policy around routine cleaning, and a policy around having 3 patient identifiers. So the idea of 3 patient identifiers is to prevent, like the example that I gave before, prevent mistaking patients that may have similar names, or making sure that we have the right patient in front of us. So an example of 3 patient identifiers could be name, date of birth, and address. So you may have 2 patients with the same name. It's unlikely that they'll have the same address, and highly unlikely that that you'll have 2 patients, same name, same date of birth, and same address. That may be then a case of a duplicate record, which happens a fair bit, where we've actually created 2 records for the same patient, and that's part of also cleaning our data, making sure that we're merging those on a regular basis. Okay, some of the key templates and resources. Obviously, we've discussed the policy and procedure manual, and there's a wonderful, wonderful template created by what used to be the Dandenong division of General Practice, now SEPA, the South Eastern Health Providers Association, and I'll provide the link so you can access that template. Triage guides, and also SEPA also have guides to download. So they've got a sample wall chart and also sample cards of what do we do for different conditions. So what do we do in case of someone coming in short of breath, or what do we do if they're coming in with chest pain? And it's a great, those cards are really good for especially for admin staff, because it gives them something to do with the patient, or how to support the patient while the GP might be, on the way, or while they're trying to get the nurse to come in, or even support them over the phone if they're having that conversation over the phone. The staff training sheets, as I discussed, they're available on the website, and you can download them at any time, or just send me an email if you're having trouble finding them. And a lot of these resources, all of these resources can be downloaded from the practicenursing.Info website, just practicenursing.Info/accreditation. And I'll show you here where they are. So if you're on the practicenursing.Info site, there is a resources tab, and under that resources tab, you just put your mouse over that. It'll come up with the accreditation option. Just click on that, and it'll take you to the accreditation page. Okay, where to from here? We're pretty much done with this session. I just wanted to make sure that you check out our upcoming intensive workshops. We run intensive workshops on travel medicine. So we have our best practice in travel medicine and related vaccines, which has become quite popular, and that's an introduction for both practice nurses and GPs. Although we've even had practice managers who are wanting to get the fundamentals right around travel medicine. So all the travel health advice, or how to implement it in our clinics, what are the key updates, key resources. The other workshop that we're running is Mastering Care Plans. So that's GP management plans, team care arrangements, and Medicare items made easy. That's been also highly popular, and that goes into the nitty-gritty of not just what the Medicare items mean and how they all work together and the referrals, but also what are the steps of the actual patient consult. So when you have the patient in front of you, what are the things that you go through? What are the things that you check? What are the things that you update? What actually goes into the plans? And yeah, it's quite very, very highly practical. And all the templates that we talk about and that we've created are provided as part of that course. And we've also now got training for allied health professionals, especially around Medicare items and yeah, the multidisciplinary care plans, and what are their responsibilities on their end from a Medicare point of view, and how to really connect with general practice so that we have a meaningful outcome for those patients. And if you're interested, or if you want to pass along those details to any allied health professionals, the website for the allied health professionals is www.alliedbridge.org. Now, just remember that we are only ever a click away. So feel free to shoot us any questions that you may have. Visiting practicenursing.Info, you can go to the Contact Us page and and shoot us an email, or the contact details there. If you wanted to reach me, there's my phone number and mobile number is there, so you can also give me a ring. I hope you've enjoyed this session, and if you want a CPD certificate for this, you can get a CPD certificate for having attended or having watched this session. Just send us an email or click on fill out the form in the Contact Us page. That's it. Thank you very much, and I hope to see you around.